Hi, I wanted to take a few minutes and give you guys just a little guidance because I know that some of you guys are going to be studying the skeletal system this weekend, both for lab, because you'll be having a quiz next week, and also for lecture. So there's some things that tend to work really well and are good habits to get into about studying the skeletal system. And this is a little further on in your notes, but I thought it might be a little more useful to give it to you right now. So I'm going to take a few minutes and do this. It probably won't take very long. Um, and remember, just another reminder, that the bones that you learn in lab will be part of your lecture test. Although it's going to be a relatively smaller part, I still want you to be studying them simultaneously. Okay, so after teaching this for a while, I've figured out that there are some things that students can do that will increase their likelihood of doing well on anything related to the skeletal system. The first thing is that knowing what the words mean is very useful. And if you bought a lab book, there is a table at the end of one of the skeletal system labs that tells you the meanings of a whole bunch of different bone markings. If you didn't, there's an exercise, I don't remember if it's on 167 anymore, but it's around this picture, close to this picture, that has a little table and a figure that shows you what the meanings of the bone markings and bone features are. So let me just tell you what I'm talking about. So if I tell you that a condyle is a rounded projection, then you can go find condyles on multiple places. So here's a condyle, but here's a condyle too, right? It's called the condylar process. And oh, look at that. This is, there's a condyle here, and a condyle, lateral and medial condyle here. So if you go look around and find the things that are called condyles, you will start to see what they have in common. And then the next thing is, of course, part of the reason I had you learn what epi meant is because an epicondyle, right here, will be sitting on or near or upon a condyle. So you'll have a lateral condyle with a lateral epicondyle, a medial condyle, a medial epicondyle. Now you won't always necessarily have condyles and epicondyles in the same place, and that's really not the point. The point is to try to figure out what all of the condyles that you see have in common. If you see a foramen, of course you know it's going to be a hole, right? The obturator foramen is a big one, but you also have even little bitty foramens all the way up here, right? You got a mandibular foramen and a mental foramen. So obviously that means hole, and you're going to start to figure out that those have those things in common. Why is that helpful? It's helpful because when you are, for instance, in a lab practical, remember that it's not multiple choice. You have to come up with not just mandibular, but also foramen, or not just mental, but also foramen. So the meanings of the bone markings is very helpful. And so in addition, so after you find a condyle, go find as many condyles as you can, or as many ramuses as you can, and try to see what they have in common. A ramus means branch. So if you start looking at the things that have a ramus, it's generally something projecting off of something else. So let's go back to here for just a second. So this is the mandibular ramus, but this is the ramus of the pelvis. So it's usually got like a straight part in a bone. Okay, so you're going to see ramus, a ramus in multiple places. You're going to see spines and fossas and facets in multiple places. And you need to know what those mean. Okay, so my next recommendation is this is just a good habit, and most students will not do this habit, but I hope that you will. So if, for instance, I bring up this figure and I say, name this feature, not the bone. A lot of people would say that is the temporal process, but a much better habit is that this is the temporal process of the zygomatic bone. Um, Even better, this is the temporal process of the right zygomatic bone. This is the zygomatic process of the right temporal bone. So if you get into the habit in which you don't name a feature without naming the bone, it forces you to remember what features are part of what bones. For instance, this is not the styloid process. This is the styloid process of the right temporal bone. This is the mastoid process of the right temporal bone. This is the external acoustic meatus of the right temporal bone. This is the squamous portion or squamous part of the right temporal bone. So it forces you to not just know the feature, but also know the bone. Because although it may seem like a trick question now, I promise you it's actually not. A lab instructor or anybody else could actually put a tag right here, and instead of what you expect, which is name the mastoid process or name this feature, they could ask you name the bone. And if you put mastoid process, you would get it incorrect because the bone is actually the right temporal bone. So if you get into the habit of naming the feature and the bone simultaneously, you will get around that. Okay, the other thing, and I know most of you guys have probably noticed this, but if you haven't already, in your textbook, the bones of the skull specifically are color coded. So notice right here that this is the sphenoid bone, right? And that's not usually the way that you look at the sphenoid bone. This is, but they're purple from both directions or from any direction. So that helps you to get a good 3D understanding of what the sphenoid bone looks like. You can even look at it from within the skull, right? From underneath, from the side, and it helps you to figure out the three-dimensional relationship of the parts of the bone. Okay, so if you get into the habit of, they call it parenting, parenting the feature to the bone, then there really aren't any trick questions that they could ask you by tagging a feature. Okay, and then the next tip is, okay, for learning the bones, especially when you start getting to the appendicular bones. So how do you figure out what you're actually looking at when you're looking at a an appendicular bone? Well, first is you're going to need to find on each bone, and of course this is the humerus, you're going to need to find a lateral or a medial landmark that's really dependable and you can always recognize it. So sort of the obvious one for this one would be the head is of course a medial landmark. It doesn't have to be the same one, but the reason you're doing it is because you always want to be able to take that bone and figure out whether the bone, if it were part of a person, would the person be face up or face down? And where would their head be? And where would their feet be? And this one, it's got it drawn in, and that's super helpful. But remember, of course, you're looking at disarticulated bones, and they're not going to be oriented like this one is. You can pick up the bone and put it down anyway, but if this is the medial landmark, and then if it's a long bone, you need a proximal or a distal landmark, superior, inferior, or whatever you want to call it, depending on whether you're looking at limb bones or not. So the head is both medial and proximal. Does that make sense? A medial and proximal. So that means that what I'm looking at here is the person's head is up here, obviously, the feet are down here, and this is medial. So you've got, and then the other thing you need is an anterior or a posterior landmark. You don't need both. But for instance, with the humerus, a phenomenal posterior landmark is the olecranon fossa. So it's always posterior. The reason you do this is because it helps you to side the bone. Because if you put the bone down and you don't see your posterior landmark that you memorized, you're looking at the anterior side, right? So you don't need to memorize for each bone proximal and distal landmarks, superior and, lateral and medial landmarks, and anterior and posterior. You just need to do enough that you can always position the bone. And I don't know if anybody has mentioned this to you before, but generally, although there are exceptions, you are not going to be able to touch the bones during a practical. You're not going to be able to pick them up and move them. So a good way to practice is to get either with a partner or go by yourself to the library or to Open Lab. Pick up the disarticulated bones and put them on the table or have somebody do it for you. And then you have to figure out what position that person's body would have been in, right? Face up, face down. What are you looking for? Where the head, where the feet? And then you do left and rights. So you have to practice sort of your way through figuring out lefts and rights. There are a couple of tricks though. So for each bone, find an anterior, posterior landmark and a lateral or medial landmark. And so usually the proximal and distal is not very hard. This helps you position the bone correctly. And then go to the library, start pulling them out and identifying them without touching them. Position them differently each time. It's especially helpful if somebody else pulls them out for you because you may not realize it, but you're probably in the habit of putting them down a similar way each time. So where their head, where their feet, face up, face down. So, and then the other thing is, although as silly as it seems, touch that bone or that feature on your own body when you can. So if I am, for instance, looking for the lateral malleolus, right? If I am going to look for the lateral malleolus, what I can do is run my hand down the lateral surface of my leg all the way down to my lateral ankle bone and touch that, and then tell myself at the same time that I'm touching it that this is the fibula, right? This is the lateral malleolus of the fibula. And then on the other side, touch it again, it's the medial malleolus of the tibia. Okay, and then like touch the mastoid process of your temporal bone on your head. Touch styloid processes when you can find them. Find the olecranon process sticking off on the back. Find the anterior superior iliac spines. When you make that connection to your own body, you have more ways to remember it. It's sort of a kinesthetic learning technique, and I know it sounds silly and it probably even looks silly, but who really cares if you get the grade that you want, that you looked silly trying to get it? Okay, so, and then this last one is just a habit that most people don't try until they actually don't do well on a practical. When you are identifying whether it's bones or muscles or anything else, saying them out loud does not mean that you can write them down. So again, a good way to practice is to get with a partner in the library and or at Open Lab. Somebody pulls out a bone and puts it on the table, and then you try to position yourself and you're like, oh, okay, that is the right femur. I'm looking at an anterior view, and I'm not just going to I'm not just going to say the greater trochanter of the right femur. I'm going to write it down. Greater trochanter of the right femur. Lesser trochanter of the right femur, the intertrochanteric line of the right femur. So you need to practice actually writing, because otherwise, once you get to lab practical, you will not be able to come up with that jumble of letters all simultaneously. And if you practice writing, what the other person can do is, if you are quizzing each other, the other person can grade your spelling. So write it down, go to the next one, they point to something else, you write it down. This is the lateral epicondyle of the right femur, the medial condyle, patellar surface. I don't think you had to know patellar surface. Adductor tubercle. So, and then don't be supportive but rigid critics on one another if you're studying together. Make sure that the other person is checking your spelling, making sure that you put rights and lefts, and then you can help each other get into the good habits that you're going to need. So these study tips are even more important for your lab practical than they are for lecture. Although by the time you finish studying for this lecture test, I would easily expect you to be able to look at this bone unlabeled and tell me that that is the right femur. And there are a couple of other ways of sighting bones. And we'll talk a little bit more about sighting bones when I talk to you guys on Monday. Don't forget that when you are in lab, or even when you go to the libraries, there are articulated skeletons that have all the pieces put together. And when you cannot figure out how something is oriented or how it's supposed to go together, just go ask the articulated skeleton, because it's all put together, I assume, properly on the articulated skeleton, and you can see the locations, the articulations, how things actually fit together. And sometimes it's a little counterintuitive, so it's a little helpful to do that. Okay, so it's just some pointers and tips. I am going to put these bones on your first test, and I'm going to be relatively clear about what I'm going to try to be very clear about what I'm asking. This guy right here is, of course, the right os coxa, coxae is plural, and I think that large features like this, like the greater sciatic notch or the obturator foramen, I think that all of those are big enough to even see on a two-dimensional, even if it's a black and white image. So just so you know what I'm thinking. I wouldn't, for instance, expect you to be able to distinguish the ischial tuberosity. And a lot of these structures kind of run into one another until you actually, like the inferior gluteal line on an image is almost impossible to see. So you can expect me to be fair about my questions, but I do want you to start studying and start making sure that you know all of the major parts of the features before your test, which is next Wednesday. Okay, I hope you guys have a great weekend, and I will see you on Monday.